we're just going live. It says it's taking a minute to get us going. And so we should be live now. So I want to welcome everyone, those of you that are live with us on YouTube, and many of you that are here in the Zoom room. We should be live now. So I want to welcome everyone, those of you that are live with us on YouTube. That's weird. I'm getting an echo back. Here in the Zoom room. We should be live now. So I'm going to see if somehow I was getting a double echo. So sorry everyone there, not sure. It's the fun of technology in this age of okay, hopefully that stopped and I'm back now, so everything's fine. Let's try this again. So
yeah, just while we're waiting, a reminder, if we could all turn our cameras off and also mute yourselves, because the way Zoom works is if you start talking or make some noise, then you'll end up on the screen and everybody will see you, your PJs maybe. So please make sure you turn your cameras off and mute yourself as well.
Okay. And I'm not sure why, but all of a sudden we had that technology glitch, but now I think we're really ready to start. So I want to welcome everyone, those that are here with us on Zoom, and all of you that are with us live in the Zoom room and on YouTube. And I want to say it's such an honor for me. It's my evening, I feel like saying tonight, but it's today wherever you are in the world, because we are so blessed, Sarah, to have Dr. Buckley joining us. Not only has she been a dear friend to me and an inspiration, because her work for me is life-changing, but she's trained as a GP with qualifications in obstetrics. She's been writing and lecturing to childbirth professionals and parents since 1997. And I've been trying to think when was the first time I met you, but I think it was really in the early 2000s, because you already started rocking my world. And you are well known for your book that's required reading for all my students, Gentle Birth, Gentle Mothering. She has an interest in the hormones of the physiology of labor and birth and the impacts of interventions. In 2015, she completed an extensive report on this topic, which I refer everybody to, The Hormonal Physiology of Childbearing, that was published by Childbirth Connections. And if you're here tonight and you haven't read that report, that's going to be required homework, because it's so groundbreaking. And Sarah, it's amazing, because I know how busy you are. You're currently doing your PhD at the University of Queensland, researching oxytocin and the autonomic nervous system in labor and birth. You have numerous papers, and it is just such a pleasure to have you join us tonight, especially in these uncertain times, understanding how our hormones can be our helpers and bring us to more common connection. And before I turn it over to you, I just want to say thank you to the many people here. This is also a fundraiser for Robin Lim, another dear friend of Sarah and I, who heads a birth center, actually several of them in Indonesia. She's currently at a difficult birth tonight, so I'm sending her, and I hope you'll join us with sending her really good energy for a gentle birth. But right now, your donations for this talk tonight mean a lot to Robin and all the people she cares for. So I know you all join me in welcoming Dr. Sarah Buckley. Thank you so much.
Thank you, Debra, and it's beautiful to meet you virtually. We had some great plans to meet up in Bali with Robin in June, but for obvious reasons, that's not going to happen. So it's beautiful to see you. And also, you know, a big welcome to everybody online, everyone around the world. I know many people will see this video as well. And, you know, we send our love and our prayers to you at this intense time for everyone, but especially if you're an expectant mama or a birth worker. So we're holding you all in our hearts at this time. So I hope that at the end of this, you can feel a little more comfortable, a little more relaxed with the situation that you're in. So we're talking about COVID-19 virus. Your hormones are your helpers. And we're going to start with some basic information about COVID-19. It may be things you already know. You may learn something. And as I say, you can watch this video again because we'll be recording it and putting it on YouTube. So yeah, as Debra said, I'm trained as a family physician or GP. I have a diploma in obstetrics. I'm a full-time writer, researcher, and also mother. And that's really what got me into this, is the beautiful experiences I had giving birth to my 4 children at home, who are now adults, as you can see. And I'm a PhD candidate looking at oxytocin. We're publishing some papers on oxytocin and the autonomic nervous system. So that's not the focus of my talk so much, but if you're interested, you can ask me some questions afterwards, because we will have plenty of time for questions and answers at the end. And I live in beautiful Brisbane, Australia, and it's not quite in the middle there, but you can see where Australia is. We're down under, and it's morning, 8 o'clock in the morning here. I think 6 o'clock in the morning actually on the west side, and I know it's different time zones all over the world. And I know now's not the time to travel, but do come and visit us. We've got beautiful beaches. We've got interesting wildlife. That's a little wallaby and Joey on the beach in Tasmania. As Debra said, this is my book, Gentle Birth, Gentle Mothering, and some of what I'm talking about today is in my book. And also I recommend that you check out my report, Hormonal Physiology of Childbearing. It's a free download. It's a long read. There's a lot of detail in there, but the executive summary is just 10 pages. So it's a great read to kind of dig down if you're interested in the research, where's the research that supports the things that I say, that our bodies are superbly designed. If you want the very short version of it, go to my website, sarahbuckley.com, and you can sign up to my newsletter and at the same time download my ebook, Ecstatic Birth, Nature's Hormonal Blueprint for Labor. It's a very non-technical version of the kind of things that I'm saying there. So those things are free. I've also got some blogs on my website that I'll be referring to in a minute. And as Debra said, this is a fundraiser for the work of the beautiful woman, a friend of ours, Robin Lim, CNN hero, who set up and runs this organization, Bumi Sehat, in Bali, Indonesia. And Bumi Sehat not just cares for women having babies, but they've built a big modern hospital. They support the community with health, with well-being. And at the moment in Bali is a kind of on our back doorstep in Australia, and 80% of Bali's income comes from tourism. So not only is Bali in this situation of, you know, not having a lot of resources in Indonesia to deal with the COVID-19 infection and pandemic, but also the people there are really not getting the income that they would usually get from tourism. So your donations are very much appreciated. And yeah, we're sending all our love to Robin, who's at a difficult birth right now, and we hope that all comes through for everybody. So yeah, some of the information I'm giving you is actually in a blog that I've just posted. Well, I didn't check, but it should be live now. Questions and answers for expectant families. So some of the basic information comes from there. And the other thing that's useful in that blog, if you go to the bottom, there's a whole lot of links and resources that you can look at, and some of them, like the World Health Organization, some of the policy statements are continually updated because we are in uncharted territory, if you like, and things are changing rapidly, as I'm sure you're aware. So what is this COVID-19 all about? You probably know some of these things. It's a new type of coronavirus. The coronavirus has also caused the common cold, but this is obviously bigger than the common cold. It's technically called the SARS-CoV-2 virus. And because it's new, this is the problem. None of us have immunity to it. So that's why it's been able to spread so widely, because no matter how many colds or flus or whatever we've had, we haven't encountered this virus before. And that's how our bodies, our immune systems know what to do flu is when we've met something before. That's immunity. So that's one of the problems. And the other problem is that it's so easy to transmit. Just being in the space with someone, having a conversation with someone for more than 15 minutes can spread this virus. And there's some evidence that may also spread through surfaces. We don't want to get too paranoid or worried, but we do want to take care. And then this virus causes what we call COVID-19 illness. So how do you know you've got this virus or might have this virus? Well, the main symptom really is fever. So most people have a fever. More than 2/3 of people have a dry cough. People get tired, and about 1 in 5 people get short of breath. But what we're discovering, and these are really kind of new discoveries as we go along, is that many people have mild or even no symptoms. And that seems to be especially young people, children under age 18. It's rare, very rare. It's exceptional. It's newsworthy to get a young person with a significant infection of COVID-19. So that's kind of good news for those of us that are parents as well. How do we know that it's COVID and not the flu? This is actually from the Australian Government Health website. So these are some things that might help you. COVID-19 is not so, we don't really get sneezing. We don't tend to get runny noses. We don't tend to get headaches so much, but you can see the cold and the flu have different kind of symptoms. So if you're worried about it, you'll have to look up your local resources. Here in Australia, there is a hotline that people can ring up and get some advice. But I'm kind of putting the slide here, especially if you're looking at the recording, you can go back and access that as well. So there's a 4 to 5 day incubation. So that's kind of a medium incubation period. It can be a little bit lower, it can be a little bit more, but that's very much what most people have. So if you encounter someone with this or who could have this, you're going to get symptoms 4 to 5 days later. And 80% of people, this is good news, have a mild or moderate flu-like illness. They can look after themselves and their families at home. They don't need dedicated care. But 20% of people have a more severe illness. They need hospital care. And what tends to happen with COVID is you get the infection, you get these mild or moderate flu-like illness, but then 5 to 7 days later, the virus can go into the lungs, and that's where it tends to cause the problem. So, you may not even know you have it. And the problem is we haven't had the ability to widespread test everyone. So we really don't know actually how many people get this and have no symptoms at all. It could be actually very common to have a mild case of it, but obviously the ones we know about are the people that get symptoms. So 6% of people need intensive care, even a ventilator to help them to breathe. And there is a mortality that we're arguing about. Is it 1 in 2? Is it 1 in 20? Is it 1 in 200? Again, we don't really know that because it may be different in different populations. And we're really relying on papers that have been published mostly out of China. And that population may be different. In Italy, the population is older. So those people do tend to have a rougher time. Just make sure everybody that we turn our microphones off and our videos off as well. Otherwise, we can hear you. So please make sure that you turn your microphones off. Thank you. Otherwise, we're going to hear your children who might not be so happy at this time of day. Okay, Mariko, I think that might be you. Could you turn off? Okay, thank you. So how can we protect ourselves and our families? Well, you probably know these things. Hopefully they're strong public health messages in your part of the world. So keeping a safe distance from others. It's mainly droplet spread. When we cough, it comes out and it can travel a meter or maybe at the most. So if you keep a safe distance from others, even if they're coughing, you're not going to have those droplets land on you. We need to avoid touching surfaces because those droplets can land on surfaces, and we're getting more evidence that they can last quite a long time on those surfaces. So that's really why it's so important to wash our hands frequently, because we may someone may cough on us directly, or we may touch a surface that they've coughed and then touch our face. So stopping touching our face, how do we do it like 20 times an hour or something like that when people have looked at it. So that's really important. But the more we can wash our hands, so that means even if we have touched an affected surface, we wash our hands, and we don't need anything fancy. We only need soap, because the outside of this virus, you can see a little picture down the bottom, is actually a lipid or fat, and the soap breaks down the the fat. So once it encounters soap or something that dissolves lipid like alcohol, as in hand sanitizers, it will that will eradicate, that will kill the virus. So soap is best. We don't need anything fancy. There's a video, if you go again to my blog, on how to wash your hands with soap. There's some quite cool videos actually where they've got a dye on their hands, and you can see that unless you do this full hand washing over about 20 seconds, you actually don't get it all off your hands. And of course, as we are probably practicing, and most of us all over the world, stay home as far as possible. Stay in your place, and then none of these things will apply to you. So as far as possible, and again, that has its challenges, but stay safe. So as I said, COVID-19 and pregnancy, it's very new. We don't really have a lot of studies, and everyone's rushing to publish all the information that we have. So we really are making some policies and some understandings based on very limited information, really maybe dozens minimum. I think around, we might be up to 24 or 30 publications in the literature of women who have had this, and they've written about it and shared information worldwide. So that's the problem, is we do have very limited information. But what we have is kind of good news, because it's not more severe in pregnant women than it is in other adults. And that's really good, because some of these viruses are more severe, like influenza, like MERS, like SARS were more severe in pregnant women, but this one isn't. So take a big breath and relax, because we're no more likely to, in pregnancy, to have a problem than other adults. The second point, it probably doesn't cross to the baby. I'm talking about the baby in the womb. Could the virus get into our bloodstream? Could it cross to the baby? Could it cause problems to the baby? It probably doesn't, as far as we know, but again, it's very limited information, and it's kind of tricky to discover that. We've got to test the baby straight at birth. We should swab the baby, because the tests, actually, I didn't mention this, the tests we're using are mainly swabbing secretions, like we swab the nose, and the vaginal secretions have been swabbed and not found to have it. Swab the baby's secretions, and that's the main reason, that the main way we diagnose it. So it hasn't been found on secretions in newborn babies, but they have found antibodies, and that's a sign that maybe the baby has been exposed in labor. It's actually a good sign, because it means if the baby has been exposed, they've made their own immune factors to protect themselves. And generally, again, it's hard to generalize, because we have such limited information, but most newborns exposed to it have had good outcomes, have not been problematic, because again, as we said, it's tends to be much milder in newborn in young people, but in newborn babies as well. If the mothers have a severe illness, and obviously they're not breathing properly, and they have these pneumonia, and they're not getting oxygen, then obviously that can affect their newborn babies. But generally, the newborns have been in good condition. And again, if you go to my website, if you want to know all the information, there's actually a really nice link there. Someone's gone to the trouble of collating all the data that's published so far. So you want to look at all the studies, and he's even looked at, is this study duplicating the women that are in another study? So that's really helpful if you want to really get on the ground with what do the studies show. Again, it's not been found in breast milk. That's good too. It's not transmitted through breast milk. So as far as we can tell, breastfeeding itself is not a problem. But the contact that we have with breastfeeding could theoretically pass it on to the baby. But the good news about breastfeeding is that when actually we or our babies encounter an illness during breastfeeding, the illness comes into the mother's body, she kind of processes, makes the antibodies, and the antibodies pass in breast milk. So even though we haven't done that research so far, well, it hasn't been published as far as I know, not up to yesterday at any rate, it's very likely that a breastfeeding mother will, if she's exposed, will pass those antibodies to her baby. So it's good news for breastfeeding. In some places, they've kind of quite who could say brutally or, excessively, I would say, separated mothers and babies if the mother's infected, to try and protect the baby. But that has its own problems, that's going to have impacts on breastfeeding, on mother-baby bonding, and down the line, that's probably going to be, well, almost certainly going to be a worse health outcome. So the World Health Organization, you can see some statements on my blog. The World Health Organization recommends that mothers and babies are kept together. So that's really important to know. My blog at the moment is kind of basic stuff, but there's an upcoming blog. The next thing I'm going to write is question answers for labor and birth. So if you go to my website and sign up to my newsletter, you'll get the notice when that next blog comes out. So some of it I'll be sharing. So COVID-19 and birth. So that's a slightly different thing because of the social situation and the medical situation that we're in. And I know many of you are living in places where it really has become a stretch for the hospitals and the medical resources. So there's large numbers of infected people who are patients in hospital and clinics, including staff. So in some places, 20% of staff are infected. And, you know, I really send my heartfelt wishes to everyone listening on here who's on the front line. We really appreciate what you're doing every day, looking after people affected by COVID-19 during labour and birth. So our resources are stretched in some places more than others, and there is a risk of infection within a hospital setting to anyone who comes in, including pregnant and birthing women and staff. And you may have noticed that some of your healthcare now will be transferred online, telehealth options, virtual doulas. Some of these things that we never thought would happen are happening, you know, and in some places, you know, women are encouraged to have their own blood pressure monitoring, or maybe go to a pharmacist, a drugstore, and get your blood pressure checked. You've got your own urine dipsticks, and it's amazing what we can actually do online. So that's really important too. Telehealth it's called. And then, of course, in these institutions and these hospitals and clinics that are affected, they need to protect people. So they're going to enact strong infection control. And we might look back and think some of these were an overreaction, but on the front line, it's so important that we protect the staff as well as everybody who comes in. So, you know, some places are limiting support people. I just was really happy to hear that in New York, they've made a pronouncement that every birthing woman has at least one support person. That's really good to know, but she may not be able to have two. She may not be able to bring her doula. So maybe Debra, you and I can talk about virtual doulas. It's not my area of expertise, but I know that you have some great resources and ideas for that. So how can we avoid these difficult situations, avoiding hospital visits as far as possible, telehealth checkups? If you've got a midwife and she's got a clinic that's outside the hospital setting, then that's going to be a lower risk as well. So what happens when it comes to labour and birth? What can we do? Well, obviously, we can avoid hospital and have our babies at home where we are in our own, you could say, biological setting as well as our social setting, where the risk of catching it from someone else is much, much lower. I know that home birth facilities all around the world are getting lots of inquiries. In some places like the Netherlands, they've actually, because they have within the system an organised home birth system, they're moving women out of the hospitals to home birth. So that really is an ideal situation in lots of ways. But the facilities may not be available to you. Often it's your own expense, so it's expensive. And of course, the home birth midwives have to look after their own well-being as well, and monitor their own bookings, so they may not have capacity as well. But it is a great option, and I certainly recommend that you look at that. And from my point of view, it's a very safe option. All my babies were born at home. So yeah, you can ask more about that afterwards if you like. But if you are going into hospital, you know, take some support with you. You know, you can take your own midwife, hopefully in some situations. You may or may not be able to take a doula, but again, virtual doulaing is something we can talk about. But of course, the more time you spend in hospital, the more likely you're more at risk you are. So how can you limit your time in hospital? And this is one of the things that I'm going to talk about here. Arriving late and leaving early is increasingly a good idea if we're going into an institution. And if we have the more we can optimize our physiology and have a physiological and normal natural labor and birth, the more likely it is we can arrive late and leave early. So it's all about the hormone oxytocin, and you probably know lots about this hormone. You've heard of it. It's the most famous birthing hormone. Maybe in the chat list you could say, what do you know about oxytocin? Because a lot of us have heard of it. It's been called lots of things, the cuddle hormone, the hormone of calm and connection. So we're going to take a minute here to have a little oxytocin moment. It's a thought experiment I'm inviting you to do. So if you want to just close your eyes, and in the privacy of your own mind, we're going to have an oxytocin moment. So if you just imagine yourself having a cuddle with the person in the world that you most like to cuddle. And anyone, it could be a partner, it could be a friend, it could be a relative, it could be a baby, it could even be a pet. But imagine your arms around them and maybe their arms around you. And just imagine maybe the smell of them and the feel of them. And imagine yourself just sinking into that beautiful, warm embrace. And we're going to just together take a couple of big, deep breaths, just inhaling that beautiful feeling and breathing out. And just sinking down into that. Yeah, beautiful. And then another breath, inhaling the smell, the feel, the relaxation, the softening, and breathing out. Okay. That's beautiful. We could stay there all day, couldn't we? Okay, so I just get you, I'm not going to be able to see this, but in the chat room, if you could just maybe make a comment about anything that you noticed or felt, how you, your emotions, your mind, your body even, like what did you feel in that moment as you felt that cuddle hormone surging through your body? Just, do you have any feedback there, Debra?
Yes. So we're seeing letting go, my breathing slowed. I'm feeling warm and relaxed. Noticed it made me smile, warmth in my body, softness in my chest, warm, happy, calm, sleepy.
Yeah, beautiful.
I
Thank you.
love them.
Okay.
We are getting questions. Do you want me to save them to the end, Sarah?
Yeah, we'll save the questions till the end because some of them might be answered as we go. And we've got this time for questions and answers at the end, maybe 20 minutes, maybe 30 minutes. We'll see how we go. Okay. Sure. So what you've experienced is what's been called calm and connection, which is really a good summing up of oxytocin and some of the effects that oxytocin has. So as I said, it's been called the cuddle hormone. You just experienced that. And some of those comments that you've shared really relate to the ability of oxytocin to reduce stress. It reduces stress hormones like adrenaline. It switches us out of the sympathetic, the fight or flight system, and switches into the calm and connection, the parasympathetic nervous system. And it also reduces cortisol. And when we're in that calm and connection system, it switches on rest and digest, relaxation and growth. It aids healing. It's good for our immune system. It's antioxidant. It's anti-inflammatory. So many good things about it. But some of you mentioned that you felt warm, and that's really a marker of that shift in your what we call autonomic nervous system. That's the balance between the sympathetic, the fight or flight, and the parasympathetic, the relaxation and growth. So as the sympathetic goes down, it actually shifts the blood supply in our body. So when we're in that fight or flight, heart's racing, the blood's going to those parts of our bodies we need for fight or flight. So the blood kind of gets pulled into our core, into the muscles, the heart, the lungs. And the opposite of that, the parasympathetic, the blood comes to the peripheries. We get warmer peripheries. We get warm faces. We get like a flush almost. And in some high oxytocin situations, we can even have a flush, so that we feel warm. And it's kind of a warm, socially warm hormone as well, because it encourages us to connect with people. So calm and connection. As you know, you just had that beautiful experience of it, because it has all these effects because it's released inside the brain. Yeah, we make oxytocin inside the brain, and from the brain it goes to the body, and it does that during labor and birth. We can measure it in the bloodstream, but at the same time it can have all these effects that you've just experienced inside your body as well. So it really is, our hormones are our helpers in labor and birth. That's the hormone that's helping you to go into calm and connection. It actually has intrinsic pain relieving properties, so even more help in labor and birth. And sexuality, it is a hormone of orgasm for males and females. We release oxytocin when we're sexually aroused. So the hormones of labor and birth, of having a baby, are pretty much identical to the hormones of making a baby. So we'll come back to that point. I know it's something Debra and I could talk about as well. So put your questions in there if you want to know more about that link. So the good thing for all of you pregnant, expecting mamas out there is that we increase our oxytocin in pregnancy. You know, our physiology is trying to shift us into that relaxation of growth, calm and connection, because it's good for our babies. It's good for our mental well-being. It's good for our blood flow. So we do actually have increasing oxytocin levels as we go through pregnancy And as we get to that point in labor, not just oxytocin levels, but our whole system becomes more sensitive to oxytocin in the lead up to labor. So your hormones are helping you even through pregnancy as well. And we know that pregnant women, as you get towards labor, have a blunted response to stress. That means that the same kind of stress that would cause one person to have a spike in their sympathetic nervous system doesn't have the same effect on a pregnant woman, and even more as we go towards pregnancy. So that's good news as well. Our bodies are there to help us. So the question is, how can we boost our oxytocin in pregnancy? How can we sink into that calm and connection system? And, that's one of your jobs in pregnancy, and especially at this time, you just had an experience of using your mind to create oxytocin. I mean, obviously better if you can have someone to hug, but we can use the power of our minds as humans to get into that calm and connection system. So having real or even virtual hugs, as you just experienced, can help us to boost oxytocin. Being connected to nature helps us to relax and boost our oxytocin. Basically anything, I'm going to have a few suggestions here, but you'll know yourself, whatever it is that makes you feel calm and connected, that's going to shift you into that oxytocin system, into the parasympathetic system. Connection, real or virtual, with a human or an animal, looking into your dog's eyes increases oxytocin, according to research. Eating and sharing a meal releases oxytocin. We just had a beautiful one with my own family. We all got together on Zoom, or you can do it on Skype, and had a meal together and chatted, and all in our own isolated houses. That was fun. Sex, we said sex is a great way of releasing oxytocin. You may have someone else to do it with, or self-pleasuring is great for your own oxytocin. It was a beautiful thing to do in pregnancy as well, and can get those hormones going in labor and birth. Massage, ideally by someone else, but most of us are not in that situation where that's available, so self-massage. Relaxation and resting, putting your feet up, a great thing to do when you're pregnant, good for your circulation, good for your baby, and good to get you into that calm and connection system. Because the thing is, when we're upright, it actually changes our brain chemistry. You may have noticed it's difficult to sleep upright, right? Because we get this noradrenaline, the alertness hormone in our brain, that the lower we sink, the more horizontal we are, the lower those levels go, and the more we can relax. So putting your feet up and relaxing is good. Breathing and meditation, very good for the parasympathetic system, good for oxytocin. The slow, calm breathing switches on the parasympathetic. Walking, rhythmic movements in particular, yoga, dance, and some of these things are, harder these days, but virtual. I've been doing virtual dance classes. There's fantastic stuff out there, and I'm sure for pregnant women as well. Music and singing. Singing seems to release oxytocin. We've seen around the world people getting together and singing. That's such a healthy thing to do. So virtual singing classes, I think there's some, I don't know, but music, whatever music you like that relaxes you. So it's really about what works for you. So that's kind of one of the questions. And really, I'd suggest that you make some notes for yourself. Write down 5 ways, 10 ways you can boost your own oxytocin, get into that calm and connection system, especially at this time, and make sure that you do some of those every day. So oxytocin in labor, this is a beautiful oxytocin molecule, and we're releasing it from our brain. It's going into our bodies in labor. And I'm just going to read something that I wrote in one of my blogs about oxytocin in labor, and you can go back and look at this on my blog. But the hormone oxytocin is particularly important because it causes the uterine contractions that drive labor and birth. So during a natural or physiological labor and birth, the sensations of uterine contractions are transmitted to the laboring woman's brain and drive this oxytocin positive feedback cycle, which is what that picture is there. And you may know this if you're a healthcare provider as the Ferguson reflex. So within this cycle, if you look at the top left-hand corner, we get these strong contractions, and the sensations have a specific nerve pathway that increases feedback to the brain. So uterine sensations trigger oxytocin release, more contractions, more sensations, and more oxytocin release. This strengthens labor and also helps the baby to be born quickly and easily. So as this diagram shows, this positive feedback cycle also increases oxytocin release into the brain, where it has these calming and pain relieving effects. Very welcome in labor, what you've just experienced. Oxytocin also turns on reward and pleasure centers in the brain during labor and birth and preparation preparation for mothering. So you can see all that in my epidural in labor blog on my website and that little diagram there, because we're going to come back to that. Because what's happening in labor as we're having these positive feedback cycles where the sensations of labor increase feedback to the brain, which increases oxytocin release, which causes more oxytocin in the body, which increases contractions. So it's what I call the snowball of labor. And if you've had a baby yourself, you'll recognize this. Labor's like a snowball. It starts small and it gets bigger and bigger and bigger, and in the end becomes virtually unstoppable. Yeah, once a woman's in that really strong labor, you can't stop it. And in fact, at that point, stress in labor can actually make it go faster. Yeah, because Mother Nature knows that if there's a stressful environment in the beginning of labor, it's safer to make labor stop. But if there's a stressful environment at the end of labor and the snowball's unstoppable, it's actually safer for mother and baby to give birth quickly and easily scoop the baby up and run away. So this is an important point to know, because what that means is, and you may have experienced this yourself as a birthing woman, as a birth support person, sometimes when women move into hospital in the early stages when the snowball is small, that can actually stop everything because of the woman not feeling comfortable, not feeling safe in hospital. And we'll talk about that in a minute. But if you move into hospital later, when the snowball's at this big unstoppable stage, it can even trigger a quick and easy birth. Hopefully not in the car park, but hopefully just as you come in through the door. So, and come into the room. So that's really a great way of limiting time in hospital, is this snowball of labor. Also, the other thing to say about this is that oxytocin is a key in labor and birth, but it's a key that goes into a lock. And the lock that it goes into is what's called oxytocin receptors. So every hormone, it's a substance made in one part of the body with effects somewhere else, and it has effects by binding to a receptor. And it's like putting a key into a lock. So oxytocin released from the brain travels to the uterus, finds the oxytocin receptors on the outside of the uterine muscle cells, binds to them, turns the key in the lock, sends a message into the cell saying contract. So, you probably heard about induction and spontaneous, or what I call physiological onset of labor. Well, the important thing about physiological labor and the physiological onset of labor is at that time when labor naturally begins, we have the maximum number of oxytocin receptors. So we have a lot of locks for the oxytocin to go in. So when we release it, when we start to release it in early labor, it's going to have the maximum effect. So if you want the most quick and easy labor and birth, then having a physiological onset, not being induced, is the fastest way to go. And even these studies that supposedly show benefits from inducing women, the ARRIVE trial, for example, found that when women were induced, they spent much longer in labor, 20 hours in labor. So it's not something that you're wanting to do in the circumstances of an institution with those kind of COVID-19 risks. Then after the birth, oxytocin comes into its own again. It's our best friend. It helps us to keep our newborn babies warm with skin-to-skin contact. But perhaps most importantly, when we've gone through this physiological labor and birth, had these snowballs, this positive feedback loop going, we have these peak levels in our brain, and we get this euphoria, this ecstasy, this calm and connection. As I say, it's like the best first date ever when we meet our babies with these peaks of oxytocin. So very important at that time too. So how can you help oxytocin to flow in labor? It's a big question. Well, one of the things is going back to, that we're mammals, we birth as mammals. Our hardwiring is through 65 million years of mammalian evolution. It's still in our bodies that we have to be in a safe place to give birth. Our bodies still work as if we're out in the wild giving birth. It's only been, in evolutionary terms, a mere whisker, 10,000 years that we've lived in places with walls. So our bodies are still hardwired to make sure that the laboring female is in the safest place possible. So how the laboring female feels, that she feels private, safe, and unobserved. And, if you're not feeling that way, it's going to be hard for your labor hormones to flow. Yeah. So how can you help your labor hormones to flow is to be in a situation where you feel as private, safe, and unobserved as possible. I'm not saying you've got to go to a cave or you can't have someone around taking care of you, but it's that feeling of feeling unobserved. Yeah. And many animal births, animal labor and birth, there are other members of their social group that actually support them, like elephants, like the dolphin midwife. But so it's not necessarily being by yourself, but it's really, how do you feel private and safe? And most women do feel more safe when they're with other people around. So that's the other question, is what's going to help you to feel private, safe, and unobserved. And as we'll probably get into talking about here, that it's the same conditions for having a baby as making a baby. You know, it's difficult to make a baby if you don't feel private, safe, and unobserved, right? So you could apply that kind of lens to the situation that you're birthing in, or at least for the majority of labor until the snowball gets really big. So, you know, your home is going to be the place that you feel most private, safe, and unobserved. So how can you, you know, configure your labor and birth to be at home for as long as possible if you are going to be moving into hospital? And again, we can talk about some solutions there, but having your own midwife, your doula at home, having a virtual doula, these are all things that could help you to know when that time is to to transfer into hospital. So what's going to help you to feel private, safe, and unobserved? And again, this is something that I really encourage you to dialogue with your care provider, with your partner, with your birth support person. You know, how can you do that? Because, you know, it is possible to go into hospital and feel like this. You know, some of this limbic part of our brain that's always monitoring for safety, that's particularly active in labor. You know, it's a primitive part of the brain. So smells and noises and what we see feeds into that. So can we kind of wear an eye mask? Can we bury our head into a pillow that smells like us? You know, I'm sure that we can talk about that as well, Debra, you know, because this is a skill that midwives and doulas have, of knowing when that time is to transfer to hospital. I'll just share one thing with you, because, you know, oxytocin and all of these hormones really pot us into this altered state of consciousness. Yeah. Through labor, we go out to the stars to collect the soul of our babies, as one Native American tribe describes it, which is beautiful. And in this altered state, you know, we do lose some of our kind of rational thoughts. So, you know, when I asked this question in some of my workshops, one of the midwives said to me, I know it's time for the woman to go to hospital when she can't remember her own phone number. So it's really a sign that you're deeply in that altered state. Yeah. And the snowball is probably big. So we can talk about that as well.
I love that.
So yeah, so that's really all I've got to say. You probably have some questions, so we've got plenty of time. We've got like another 20 minutes for questions. And as I said, there's more information in my book and my report on my website. Again, a reminder that this is a fundraiser for Bumi Sehat. So please, if you haven't donated at the end, or if you're watching this on YouTube as well, please take a minute. Even, you know, a few dollars would be gratefully received by Robin Lim and everyone at Bumi Sehat.
And
Oops.
Robin has just joined. I don't know if you're
Beautiful.
in a place where you can join on video.
I'm going to try.
I'll ask you to start, but I know if the internet's not good, we can hear you though.
Oh, lovely to see you, Robin.
Okay, hi. Am I on video?
You are on video. Yeah, we can see you.
I am. Can you see
And you know what? Let's stop the screen share and then we can see her more.
Okay. Let me go into that. Let me just configure this. Sorry,
I'm
folks.
actually at Bumi Sehat.
Push it. Is that good?
I can't see me, but I can see you. That's great.
We can see you now.
Yeah, beautiful.
I am kind of wearing my Bumi Sehat costume right now. We've been wearing masks. I'm going to move this so I can talk. We've been wearing masks and I've been up all night. We have a mother who's been complete since, I don't know if you can see where I am. I'm at Bumi Sehat. We have a mother who's been complete since about 2 in the morning. And it is now almost 7. It's almost 7 in the morning here. You wouldn't know by looking now because it's early morning, but we have 1, 2, 3, 4, 5 new babies in different recovery rooms.
Congratulations.
Thank you. And we have a mom in labor who just came in. A couple of those moms came in unbeknownst to us. They never had prenatal care with us. They're from far away, but they heard about Bumi Sehat and they got to the hospital in labor and they turned away because of what they saw, which was an overcrowded hospital. Right now we have a dengue epidemic. We have a typhoid epidemic going on, and we are probably 2 weeks behind the US on the coronavirus issue. I hope 2 weeks, maybe less. And so we're doing social isolation. The chair I'm sitting on, you see there's a bench here and it's asking people to put distance between them because we found that we moved the waiting area is very big here. So we move the benches and tables and chairs far away from each other to give people some distance. And then people would sit all huddled up in one corner. And that's just cultural here. And all of our families here in Bali, including mine, have 4 generations, 3 generations minimum. So and they have 1 little house or 2 little houses in the family compound. They spend most of the daytime hours outdoors with plenty of space, but at night everybody sleeps in a big pile. So how can we keep, it's a difficult thing. Yeah,
those are really good considerations. So, you know, whatever care that you're choosing around the world, please make it as safe as possible, and make sure, you know, you have some kind of backup. I mean, it's so beautiful that you provide that in Bali, Robin, but, you know, whatever your birth situation, have someone you can ring up, have a backup plan if things don't go well. And, you know,
everyone deserves that. Everyone deserves a skilled birth attendant or 2. I always say 1 for the mother, 1 for the baby, and everyone deserves a doula. And
thank you. Beautiful.
It's hard.
You have a beautiful comment here. Alan McAllister is with us, and she said she's been thinking of you and your guerrilla midwife skills as we explore the establishment of emergency out-of-hospital maternity centers in New York City. And I got a note also from the UK this morning that they're asking hotels to convert to birth centers in the UK.
Wow.
Yes. And I just heard that CPMs have been, they've been told that they can practice without repercussions now in New York. Is that true, Debra?
I've been hearing that, but, you know, Alan might be the one. I don't know, Alan, if you can unmute. Yes, she's saying that.
Hi, Alan. That's correct. And apparently that's only till the end of April, but I don't think they can take that back, right?
I hope not.
And that there's now the World Health Organization has said that mothers must have a companion of their choice. And so that changes everything. Hospitals were saying they can't. Yes, thank you. From Gemma Wilson, 100% of women may have their companions. Yeah, it was getting a little scary there when the hospitals were shutting down all of the things that we worked so hard together to gain for our mothers and our babies and our families. And I'd love to see it extend to the mother can have her companion, her partner, and her doula, because that is so important. And as a midwife and a doula, I know that when we have a doula, we're better. I mean, I serve the role as doula, and I'm beat. I'm really beat.
Thank you so much, Robin, for what you provide, and to all the doulas around the world who are doing such a beautiful job of supporting people.
And thank you so much for making this a fundraiser for us. We are really needing that. What does Jennifer say? Jennifer, we have here in the Netherlands, what?
A hotel that has been set up as a birth center. Grateful that home birth is available for all women here, that despite our decreased home birth rates, all midwives are skilled in home birth. Such an important thing from the Netherlands. Thank you, Jennifer.
Thank you.
Wow, that's amazing. I know my niece, Teresa McLean, who's a midwife in the Bay Area, a hotel is working with them now and negotiating with them to let them open a birth center there. My clients are finding it hard. What is Claire saying too? What's Claire saying?
It's hard to choose between a partner and a doula. It's such challenging times that they shouldn't have to choose. And Erica had said she worries that since we're now limiting to one person and doulas are often now virtual, will it make it harder for doulas to be brought back in after this passes? That's a really valid
really good
point.
question.
Yeah, it's such challenging times.
Yeah, it really is. And, you know, the hospitals also have to be cautious about their own infection control and their staff in particular, because, you know, if they get if one woman or one person is infected, then everyone who's worked with that woman has to go on leave, and that increases the stress on the staff and the risks as well. So it's a very delicate balancing act of, you know, how many people come in versus, you know, infection control and all of those questions as well. Yeah.
Yes. We're already putting our staff on more of a rolling, you know, where instead of having everyone come in all the time as they normally would, of course, midwives have always been on shifts, but we're rolling them more because, and for example, our pregnant staff, they can only work very limited hours and very isolated. We have our best lab tech is pregnant. She wants to work, but we're trying to keep her safe.
Yeah, very good. Yeah.
What's
Are there other,
saying there?
yeah. Are there other questions and comments we want to address, Deborah? Is there?
No, there's a question. Any guidelines for how to alter or not alter our practice at home and hospital with COVID, masks, baths?
Yeah.
Look, to be honest, that's out of my sphere of expertise. You know, I think I think the number one thing, and this is actually from our neighbours over in New Zealand, Jacinda Ardern, the Prime Minister there, said we should treat everyone as though they're infected. So if we were to do that, then we would be careful about working with clients as well. And I know that that's the ideal, that PPE, personal protective equipment, is not always available, but as far as possible, I think we need to take precautions as healthcare workers as well. And hopefully that your own organisation has got some guidelines for you around that. As I said, it's a fast moving area as well. So.
And it changes, like you said, fast moving day to day. In New York City, we're hearing that. What does Elon say? Yeah. I only get half of the comment.
Okay, and here's an important question from Alon. In New York City, we're hearing that some hospitals are recommending induction for women now at 38 to 40 weeks to avoid birthing in what we perceive, right, could be the peak coming in 2 weeks when hospitals are expected to be fully overwhelmed. How should we respond to that?
Well, I think everything has its pros and cons, and you know, we are in this slightly evidence vacuum, you could say, from a scientific point of view, where we don't really know a lot of what's going to happen, what's coming. We don't know what the implications are. But you know, I think everyone needs to make their own choice about that. But the problem with induction is all of the things that we've talked about. Really, like if you're not at that peak readiness for labour and birth, then you don't have the optimal number of oxytocin receptors, and you're likely going to have a harder labour, and you're likely to have a longer labor. And you know, especially for first-time mothers, you're probably going to increase your risk of a cesarean. And do you want to have major surgery in the midst of, you know, a pandemic? So because that has extra risks as well. So you know, everything is about balancing risks and benefits. But you know, and also the other thing is we haven't talked about the baby, because the baby has their own timeline. And if you read chapter 2 in my report about what causes the onset of labor, you know, the answer to that question is we don't know. We don't actually know what causes the onset of labor in humans, you know, but we know that it's closely coordinated between mother and baby. So if you haven't gone into labor, then you're not ready for labor by definition. And that readiness includes your baby. So we think it's the baby that initiates labor by passing hormonal signals through the placenta. You can read all about it in chapter 2, but that readies the mother, and then maybe the mother's, you know, 24 circadian rhythm kind of determines a time of day. Like we're more likely to go into labor at night, for example, but it's the baby's readiness that triggers labor. So, you know, if you are induced, you're going to have a hormonal gap, as we call it, in your own readiness with, I'm talking about oxytocin receptors, but there's all these other changes that happen in parallel. And then your baby's going to have a deficit in readiness as well. So I would, you know, personally, I think that's a very strong argument to have labor start at its own time. And this is my opinion. I can't give you individual advice. You've got to take things into account for your situation. But, you know, balancing that against the kind of things that we talked about, like having physiological onset of labor, ideally having someone that can support you at home, and then going into hospital for that last bit when the snowball's so big it's unstoppable, and then coming out quickly is, to my mind, that's a greater reduction in risk than having a scheduled induction, especially if people are saying 38 weeks. I mean, you know, we've kind of gone away from that medically because of the extra risk. So I certainly think under 39 weeks is an extra additional risk as well. Yeah.
Definitely. This is something that Phyllis Klaus really points out in her work, how the baby and the mother are not ready if they get induced at, you know, 38 weeks or 39 weeks even. So it's something to think about.
Yes, and there's so much, again, that we don't know. For example, we talked about oxytocin in the brain, and oxytocin released in labor that gives that euphoria and the bonding that happens in all mammals. And what happens if the mother's not quite ready for labor and birth? You know, she has that hormonal gap in her uterus that we can measure, that oxytocin receptors are lower. But what about in her brain? Is she going to miss some of that reward, pleasure, bonding, some of, Mother Nature's best start, as I call it. And, we can fill in those hormonal gaps, but it's much more effort. It takes much longer than getting those at that window of opportunity, as I sometimes call labor and birth, when the mother's at full readiness and the baby's at full readiness.
Yes, yeah.
So there are a few other comments here where people are talking about like the virtual doula. And it was a good question, would someone who's virtually be stimulating the neocortex more? And that way, Sarah, not getting the hormonal benefits, right? Because they're too much in their thinking brain. And there was a post too that Penny Simpkin yesterday did a fantastic webinar on virtual doula, and that is on Dona International, because people are saying, where is it? Jennifer saying, yes, it was excellent, worth the information. So you can get that on Dona. But what would you say, Sarah, about
again, we're in these unprecedented times, and the choices that we make are not necessarily going to be the ideal choice. You're exactly right. I mean, oxytocin is touch, it's presence, it's smiles, it's hugs, all those things that doulas are so brilliant at giving, and that actually give all these benefits that we know medically, better satisfaction, lower cesareans, less use of analgesia. It's all the physical presence of the doula. But we also do know that, some social contact, virtual contact someone did a study where it does release oxytocin. So it's obviously not the ideal, but from my point of view, it's better than nothing. And, for me, what we're talking about today, the other important role of the doula would be to help the woman to know when it's the time to go to hospital. And that happens because she's had this contact with the couple right from pregnancy. She's not just turning up in labor on the screen, but, we've got that association with her. And just, Robin, could you turn your microphone off for a minute? Thanks.
Yes, I'm just going to say goodbye. I'm just showing you one of our moms who's taking her baby on a morning stroll, 1-day-old baby. I do have to go because my mom in labor, one of them, is calling for us, and she's asked.
Well, we're all sending much love to mama and baby. And sending our love and prayers.
Everyone, stay well, stay healthy.
You too.
Thank you, Robin.
Lots of love, Robin.
Bye-bye.
Thank you.
Okay, bye.
For joining us and for all you do.
Thank you so much. Bye.
Bye.
Yeah, so a little bit of doula is better than no doula. That's what I would say. Yeah.
We have something from Lisa, which is interesting. And Lisa, thank you. In Italy is differentiating between COVID and non-COVID hospitals, which is important, and it's making it safer for birthing women. Still lots of resistance from the hospitals and institutions toward home birth midwives. They say home birth is more dangerous than COVID. And she goes, right? Oh my goodness. The women who want a home birth now are increasing. Thanks for that, Lisa. I didn't know that you were differentiating the hospitals. That's a brilliant idea.
That sounds good. And, and if we could take most of maternity care out of those institutions that are sources of infection, and unfortunately that's true generally, really, that you're more likely to get an infection in a hospital than you are at home. But, if we can take the women, the maternity care out of that and put it in a safer place for women, I think that's really good for our hormones as well. If we're not feeling worried about going into a place that is high risk for ourselves in labor, I think that's really important to help us to feel private, safe, and unobserved as well.
Yeah, and Alon saying the New York City home birth midwives are receiving as many calls in a day for a care that they would normally get in a year. And they're all completely booked, which they were pretty much completely booked even before this. And they're still receiving a ton of calls. And I have to say too, here in New Jersey, several of our midwives right now have COVID themselves. So our New Jersey midwifery staff are down, and our chief of ICU last night did a call and said that one of our hospitals, almost 70% of all patients in the hospital now have COVID. And we're at max.
So we're really sending our love and prayers to everyone all over the world in the middle of this, the mamas, the babies, the healthcare workers as well. So everybody, stay safe and relax as far as you can. Like, it's so important to tune into that oxytocin at the time and not get caught up in the stress and the panic of it, because that is happening out there in the world, and there are these difficult decisions that you're going to have to make. But you really need, as far as possible, to spend some time every day and that calm and connection, that parasympathetic nervous system. It's good for you, it's good for your baby, you know. And it could be as simple as lying down, you know, for 5 minutes and putting your hands in your belly and breathing into your baby and breathing into your belly. It's so important right now. I did have a friend of a friend who had a bicornuate uterus, and it was only actually discovered after she had the baby. She had one, you know, yeah. So some of these things we don't even know because of, you know, we only know now because of ultrasound. We never would have known beforehand. So yeah, maybe there may be some. Look, I really am not experienced to comment on that, but I know that women who've had, you know, all kinds of uterine differences, you know, our uteruses are all different shapes and sizes, and you know, the bicornuate is one variation of normal. It's like a heart-shaped uterus, and as I said, we wouldn't have known this until we started doing ultrasounds on women. So many women across time have had completely normal, healthy, happy pregnancy, labor, and birth with a bicornuate uterus, but not knowing that. So I wouldn't at this point get upset about it. Maybe, you know, talk to your healthcare provider if there's anything in particular that you do need to do. But I would say that, you know, regard everything as normal, at least to start with. Yeah, but it is a little bit out of my area of expertise. So.
Well, thank you. And Jennifer Walker's posting, visit spinningbabies.com, of course, another great resource, Jennifer. And I love, there was a post, and it's kind of going out, I think it was from Romy, to the fact that she arrived with the client to the hospital, and after being in triage a long time and not getting a room, her oxytocin levels were subsiding. And someone posted right in, music, singing, and dancing. And I think, Sarah, you gave us so many great tools of ways that we can help people and prepare them right ahead of time with their oxytocin toolkit. And as you said, trying to get there as late as possible, but so many beautiful things that you allowed us to think about bringing in.
Yeah, and I know one of the tips I've got from you, Debra, is about sexual activity. You know, you want to get yourself a private room, then take a vibrator to hospital with you and put it on the bed. And if that doesn't work, turn it on.
That's right.
You know, because with sexual activity, I mean, it's the most fun form of oxytocin in labor. And, you know, it's going to end. There's some people have described powerful effects from, you know, using sexual activity to boost their oxytocin and get their labor going. And of course, we could practice that during pregnancy as well. You know, it can be a wonderfully sexual time of, you know, where all our genitals are like very engorged with blood, and we can have like great orgasms in pregnancy that can then carry us through to pleasure in labor and birth as well. And I know that that's something that you very much looked at in the film Orgasmic Birth, and in your beautiful new book too, Sex After Baby.
Yes, and that's a good point to say, because we're kind of a little bit over on time right now, that you're going to be back with us too in a week. My new book, it's My Biggest Baby, is The Ultimate Guide to Sex After Baby, Secrets to Love and Intimacy, is releasing on April 9th. And we're going to have a whole series of webinars, lots of special guests next week. So I hope that many of you that are here will be joining us then. And on April 9th, our actual launch date of the book, Dr. Buckley, Sarah will be back with us to talk about tips once you have your baby, and look at the hormones of breastfeeding and parenting and how that impacts us and our sexuality. So we'll wait another minute on any last comments or questions. We'd love your feedback. Was this valuable? We'd love to hear you post just your closing comments. What is the main thing that you're going to take away from Dr. Buckley's talk tonight? What are you going to bring to your practice, whether it's as a doula, a midwife? We have a lot of birth keepers here, but we also have a lot of pregnant mamas. Are there things here that you're going to be able to love yourself through labor with? Oh, thank you. Hello. We're seeing Janice, I think, on the screen.
Hi, I'm Janice. I'm going to be putting up my classes on. Let me turn this off. I'm getting feedback. Sorry.
And I'm going to be just saying goodbye now. We're going to end our live right now on YouTube. We hope that you're going to follow us for all our new webinars that are coming up next week. And we thank you.